Experts are telling RTV6 COVID phobia might be keeping people with serious non-COVID-19 conditions away from emergency rooms. Troy Washington is working for you to explain why doctors say it is important to push fear to the side and come in for treatment.
There used to be a rush to get here to the emergency room, but now Dr. Ashley Meager thinks COVID-19 is making some afraid to come in to get help and relief from pain.
There has been an increased number of people avoiding the hospital, and to the point where they wait until they're so sick that it's really hard for us to take care of them.
Dr. Meager was just getting off from a 24-hour shift working as a trauma and acute care surgeon when we caught up with her.
Anytime a patient delays coming to the hospital for something that's an emergency, it puts them at a risk of a poor outcome. Don't delay coming to the hospital if you need to come to the hospital. We're going to take care of you. We're going to keep you safe. And we are here for you. The emergency rooms are open. The surgeons are there.
She wants patients to know they are in good hands and it's better to catch things early rather than later.
I woke up Wednesday morning and I was experiencing some pain on my lower right side of my abdomen. I've never had a problem with my appendix in the past. And I said, oh my goodness, I hope this is not my appendix.
Phyllis Schooler says she only waited a day before making arrangements to get checked out.
I did the virtual appointment and I was laying on my bed when I did it with my doctor, Dr. Amadou, and she was telling me where to press, and she could see with, from my laptop, and she was telling me she was thinking it was my appendix. And she asked me, will you please, is there someone that can take you, go to the nearest emergency room?
Do you worry about if you would have waited any longer? Because there are a lot of people who are waiting and things are getting so bad by the time that they go in, it's a worse situation.
I just thank God that I did not wait.
Dr. Meager says Schooler did the right thing and she wouldn't advise anyone to put off that type of surgery because her appendix could have burst. In fact, this surgeon says it's better safe than sorry, and it's important to keep up with prescribed medication.
I know that the pharmacies such as CVS and Walgreens, many of them have drive-ups, and you can drive up and do a no-touch pickup of your medications. So really stay on top of refilling medications.
Working for you, Troy Washington, RTV6.
According to Dr. Meager, patients who are more prone to developing bad COVID-19 symptoms due to pre-existing conditions should monitor themselves as closely as possible and make a point to see your doctor for checkups, even if the appointments are virtual.